Hello, friends and family and people around the world. I wanted to make a video update about how my family and I are doing during this COVID-19 pandemic. It's been week 3 now that we are under quarantine, and we live in North Jersey, right outside of New York City. So, as you know, this is the epicenter of the COVID crisis here, with the most positive cases and the most deaths, unfortunately. We minimized any outside trips unless it is emergency, like going to a grocery store or to the pharmacy to pick up a drug. But that's really about it. I am filming right now from our backyard, so we are blessed to have a place where we can actually get some fresh air, get some exercise. That's really all the social interacting that we're doing. We're strictly adhering to the CDC guidelines of minimizing social contact and practicing social distancing. I know going to the store, I wore a mask the last time and gloves, and I had disinfecting wipes with me, so I was able to wipe out the handles of the cart as well as anything that I was touching directly with my hands. It certainly takes much longer now to go to a grocery store, so you better know exactly what you want to get, and when you go there you just directly get it and get out. In the last week, I have been actually bombarded with all kinds of theories of what has happened out there. There's anything from a 5G installation to mandated vaccines, to New World Order, to QAnon movement. There's just like so many different things that people just keep sending me and saying, "Oh, look! Might be it. This might be what's going on." We all need to take a step back and pause before we accept any of these theories as the truth, because we are going through the process right now, so nobody really knows what is the truth or what is really happening. We're in the middle of the epicenter of the events, so to speculate and think that it's one thing more so than another, nobody really knows. So be careful when you disseminate information and when you're trying to influence other people's minds of what you may think is happening. A couple other thoughts I had in regards to what is next for us is nation here in the United States, also a species in the world. I mean, we've never dealt with anything of this kind of proportion before. It's unprecedented. I don't think that anybody could have been prepared quite and know what exactly to do. I feel like we're all learning as we're going. We're learning also about this virus, like how it affects us, what kind of symptoms you develop, what kind of, what to expect from it. Well, the incubation period is between a week to 3 weeks, anywhere between that period. That also suggests that many of us could carry the virus and we're just asymptomatic, which, it's a very important thing to consider when we're lifting off the quarantine. It is very contagious. It doesn't really discriminate if you're younger or older, if you're sick or not sick. There's people that actually have been in very good health who have contracted the virus and have gotten really sick. In some cases, they have even passed away, unfortunately. The testing has to improve and it has to be available nationwide for us, at least, so that we all can get tested, and at least those who don't have it, we can clear them, and if somebody has it, we can treat them accordingly and make sure that they get over the virus. Lastly, I just wanted to say this. As a nation, unity has never been more important for our survival than right now. And what I mean by that is that we need to all adhere to whatever the policies and guidelines are for this virus. So if CDC has established that this is contagious and you might be asymptomatic and you need to wear a face mask, please try to adhere to those guidelines as best as possible. Thanks also to our nurses and our doctors, our first responders, for being there for all of this COVID patients and trying to take care of them as best as possible. sometimes even without PPI or ventilators. You've been so selfless. So thank you so much to all of you for sacrificing your lives to save other people's lives.